Hi, welcome to Your Need to Know. My name is Ken Sharma and I work with Enroll Virginia. Enroll Virginia is an organization that started in 2013 to help implement the Affordable Care Act. Enroll Virginia is a coalition of nonprofit partners throughout the state who are working together to help implement the Affordable Care Act. And here in Northern Virginia, we have a wide range of partners from healthcare organizations like Neighborhood Health, Neighbors Keepers, HealthWorks, and legal services and organizations that provide legal assistance as well. So we are here to help you understand how this affects the people here in Northern Virginia today. Today we'll talk a little bit more about some of the numbers specific to Northern Virginia. Northern Virginia is a series of counties and cities that we've listed here, right here. So Arlington, for example, is a county that has about 12% of the population who are uninsured. When we talk about these adults who are uninsured, we're really talking about people who are between the ages of 18 and 65. In Virginia, people who are below 18, typically children, fall into Medicaid or FAMUS if they don't have private health insurance. And people who are 65 typically end up with Medicare or some sort of services from Medicare programs. So the adults we're talking about are really the working people between 18 and 64. So in Arlington, for example, there's 12% of the population who are uninsured, which is about 20,000 people. In Alexandria City, there's about 15% of the people who are uninsured, which equates to about 16,000 people. In Fairfax County, our largest county, we actually have 16% of the population who are uninsured, and that's 117,000 people who are potentially uninsured in Fairfax County. So let's look at it a different way. And when we look at it from what that means locally, so think about it as the number of people that you'd meet on a daily basis, people that you normally walk by on a daily basis. So for example, if you look at the number of people in your community, so in Arlington, for example, 1 out of 9 adults don't have health insurance. So as you walk down the street and you meet 9 adults, probably 1 out of those 9 people don't have health insurance. Whereas in like Fairfax County, it's 1 out of 6, right? So in Fairfax, we obviously have a higher percentage of people uninsured. And when you get to Manassas Park, that's 1 out of 4. So that's a very large number. So 1 out of every 4 people that you meet in Manassas Park or Manassas City probably don't have insurance. Even though the total head count may be less, it's still a good percentage of the people who are uninsured. So these are the people we're trying to reach today. So we want to make sure that they understand health insurance is available to them. The Affordable Care Act is there to help them get insurance if they qualify. Open enrollment for this year starts on November 1st, or started on November 1st, and will run through January 31st, 2016. So if you know anybody who is potentially uninsured, please let them know to contact us. And our information is at the bottom of the screen, enrollvirginia.org or 888-392-5132. One of the other things that we also need to think about is those people that are uninsured in our area, whether they are documented or undocumented, they still get sick. They still get into accidents. They still break a leg, twist their ankle, get sick, get fevers, whatever that might be. And what do? They typically go either without any health care, which means they're getting sicker and sicker as the days go on, or more often than not, they go to the emergency room. An emergency room in every state, every county, every jurisdiction in this country have to serve anybody regardless of whether they have insurance or not. What that means is when those people do get services from the emergency room services that they do go to, they get charged a lot of money, which they cannot pay, obviously, which means that we as a general community end up picking up the tab for all the people who are uninsured who use the emergency room services. So the more people we get insured, more people we get into the health insurance plans, the less that'll affect our overall cost of providing health care, and obviously reduce the cost of health insurance and emergency room services throughout the region. Because as I said earlier, the uninsured rates in our area affect all of us. Our tax dollars are what's being impacted when we provide services for people who are uninsured, and our insurance rates go up because the uninsured are using emergency room services. In Virginia, when the first law went into place in 2014, we had over 216,000 people signed up for the Affordable Care Act. In 2015, which was the second year of the Affordable Care Act, we were able to enroll about 385,000 people, out of which 335,000 of them paid health insurance and now have coverage. This is a great step forward for our country and for our state. But unfortunately in Virginia, we have what's called a Medicaid gap. There's approximately 400,000 people who still do not have health insurance in Virginia, out of which about 200,000 fall into the Medicaid gap. These people who are in the Medicaid gap do not have access to health care through the Affordable Care Act because they do not meet the minimum requirement of 100% of the federal poverty level. Plus, in Virginia, we have a fairly strict Medicaid program, so they're not eligible for Medicaid. So for further information, we're going to turn over to Rich to talk about the rest of the program.
Thanks, Ken. I'm Rich Nagel with Neighbors Keeper, serving residents in Prince William and Fairfax counties. And it's my pleasure to share with you some of the key reforms that expand coverage under the Affordable Care Act. Number one, there's no longer a medical underwriting. What this means is pre-existing conditions, as you may know them in the past, for injuries, illness, or some disease that would have otherwise cost you more money with the insurance company no longer exist. If you've ever sneezed and had to answer a health insurance application, there are no underwriting questions that ask medical history questions like that. Number two, young people, young adults are able to stay on their parents' insurance plan up until age 26. And that's through the year that they turn age 26. This is a great benefit to many parents who are able to provide coverage for their young adults, particularly as they come home from college after graduation and perhaps are looking for employment. The third benefit in this expansion of coverage there recognizes that preventive care services are included, and these are at no cost. This is clearly meant to be a free visit without any cost or copay at that time, and it's meant for people to take ownership of their health by once a year getting that annual checkup that's meant to provide them with the health care that they need so that they can prevent any serious injury, accident, or illness, should that be part of their medical condition at that time. The marketplaces here in Virginia are established in what's known as a federal facilitated marketplace. As an FFM, federal facilitated marketplace, what this means is the state of Virginia has opted into a partnership with the federal government to provide the front-end support of the healthcare.gov website, in which we, as assisters, are able to provide enrollment assistance to folks who need help in getting health coverage. Financial assistance is, of course, available, as the Affordable Care Act is meant to be affordable, and it's understood with a legal presence here and an income based on an estimate, individuals and family members will be able to obtain coverage during the open season beginning November 1st through January 31st, 2016. Furthermore, the presence of essential health benefits mean that all plans have to include hospitalization, outpatient visits to physicians, the behavioral health services, prescription drug plans. These are but just a few, to include laboratory services as well as rehabilitative services as well. It's understand that mental health services, or behavioral health services as they're commonly called, are available to everyone, as they now have parity with all other medical conditions in this way. So with that said, it's understood that we want people to own their health and to take advantage of those free preventive services. And at this time, I'll be followed by...
Hi, everybody. For decades, too many working Americans went without the security of health insurance, and their financial well-being suffered because of it. We've begun to change that. As the Affordable Care Act has taken effect, we've covered 17.6 million Americans. Since 2010, the uninsured rate has decreased by 45%. And for the first time, more than 90% of Americans are covered. If you haven't gotten covered yet, or if you care about someone who hasn't gotten covered yet, now's your chance. It's open enrollment season for the health insurance marketplace. What that means is, with a few clicks on healthcare.gov, you'll find private insurance companies competing for your business. You can compare plans and choose the one that's right for your family. In fact, most Americans will find an option that costs less than $75 a month. Even if you already have insurance through the marketplace, check it out. Shopping around can save you a lot of money. Last year, consumers who shopped saved almost $400. Take the story of a man named Phil Viso, who emailed me earlier this year. Phil's a software developer from my hometown of Chicago. Last winter, he had an idea for a new app and decided to start his own company. And that can be pretty scary when you need to get your own health insurance. But Phil logged on to healthcare.gov, answered a few questions, picked a plan, and even found out he was eligible for a tax credit that saved him money. And here's what he wrote. I'm still sort of in shock about how great the experience of signing up for healthcare was. I will have a lot to worry about over the course of the year as I try to get my app released, but thankfully, good healthcare will not be one of those worries. After he sent me that email, Phil ended up getting a new and better job anyway. But that's the whole point of health insurance, peace of mind. And under the Affordable Care Act, if you want to change jobs, go back to school, or chase that new idea, you can do it without worrying about going broke if you get sick. If you've got a pre-existing condition, diabetes or cancer, or heartburn or a heart attack, you can no longer be charged more or denied coverage. You can no longer be charged more just for being a woman. And preventive care like checkups and immunizations now come with no additional out-of-pocket costs. What we're talking about is no longer just a law, and it's certainly not the myths and scare tactics that the cynics have peddled our way for years. This is reality. This is healthcare in America. And the bottom line is, Americans like it. They're happy with their plans and they're happy with their premiums. So join them. Give it a shot. Check out healthcare.gov, cuidadodesalud.gov, or call 1-800-318-2596 to find a plan that's right for you or someone you care about. And by the way, if you live in one of the 20 cities participating in our Healthy Communities Challenge, I want to see how many of your neighbors you can get to sign up. I'll come visit the city that enrolls the highest percentage of folks who aren't covered right now. That's a promise. After all, this country is at its best when we look out for each other, and together we can help more Americans get the security that they and their families deserve. Thanks, everybody. Have a great weekend.
One day these rats were playing in the woods. Well, it's some matches and that's no good. Listen to smoke before you give it a try.
Only you.
Don't play with matches. Don't play with fire. Cause there's nothing very funny about ripped off money. Nothing very nice on a homeless mind. So if a gorgeous force is what you desire, don't play with matches. Don't play with fire.
Only you can prevent wildfires.
Fire.
Why don't you just wash your car at home?
When I wash my car, everything runs down the street and down into the storm drains. With all the chemicals in the soaps and waxes, the last thing I want to do is poison my own drinking water. At least here, it's all contained and recycled on site. That's why I also take my car in for oil changes instead of doing it myself. I might take a chance on spilling stuff. You know what the best part is?
What?
More time to kick back and watch the game.
How far would you go to protect the planet?
I want you to build an ark.
Here we go. Okay, that's good. Oh, okay. Ow!
Maybe there's another way.
People, the flood is imminent! Is it too much to ask for a little precipitation?
Go to fightglobalwarming.com to find out what you and your community can do to reduce global warming pollution.
Somewhere around the world, there are men and women of the armed forces risking their lives, helping rebuild communities after natural disasters, collecting toys for needy children, tutoring kids in school. These are your sons and daughters who work to keep us safe, secure, and free. Dedicated men and women who put their country first.
For our next section, we're going to be joined by Jackie Pujol from Legal Aid Justice Center, Legal Service in Northern Virginia. Jackie?
Thank you, Ken. So in order to be eligible for the marketplace, you need to be lawfully present in the U.S. So that can be a U.S. citizen, national, or any legal status. You also must live in the service area, so that's in the state of Virginia. You must not be incarcerated, and you cannot have access to affordable and adequate insurance. Through the marketplace, there are also financial help. So there are two types of financial assistances. One is help to lower your monthly premium, and as you can see, if you fall within those ranges, within the first row's ranges, then you qualify for some kind of help at a monthly rate. And the second type of help is called the cost sharing reductions, and if you fall within the second row's ranges, then you qualify for that type of assistance. Like we mentioned, there are two types of helps. The one is called premium tax credits, and that's paid directly to your insurance. And the second type of help is called cost sharing reductions, and it's paid directly to your medical providers. If your income is below 100% of the federal poverty level, there are the following programs available to you. There are community health centers around the area that you can visit and receive medical services at a low cost. There are free clinics available also where you can get free help, free medical services. There are prescription assistance programs, and you can usually contact your Social Security administration, or you can visit a nonprofit organization that can help you enroll in this program. And there is also Medicaid Plan First, but please be aware that this is not Medicaid coverage. It's actually a program that only covers family planning. So that includes Pap tests, OBGYN visits, any testing for sexually transmitted infections, and family planning education and counseling. If you do not wish to purchase a plan off of the marketplace, then you will face a penalty. Of course, there are exemptions, but for the majority of people who do not choose to purchase a plan and qualify for tax credits or make above the income eligibility, then they'll have to face a penalty. In 2014, the penalty per adult was $95. $47.50 for a child. In 2015, it will be $325 per adult, or $165 per child. And in 2016, if you do not have coverage, you'll be faced with a $695 penalty per adult and $347 per child.
For this section, we're going to be joined by April Cook from HealthWorks of Northern Virginia. April will tell us how you can apply for health insurance. April?
Thank you. There's 4 ways to apply for health insurance through the exchange. You can apply over the phone by dialing the marketplace directly at 1-800-318-2596. You can apply in person by one of us certified assisters who are here to help you. We're for free. If anyone charges you for assistance, you should say no to that and actually go to healthcare.gov and look for local help and put in your zip code, and one of us will come up in one of our locations. And also online at healthcare.gov, you can access the healthcare.gov website on your own or with us, as well as you can do paper applications. The step 1 of actually applying is creating an account at healthcare.gov. You want to go to healthcare.gov, go into the login screen, and once you get to the login screen, you want to go to where it says create an account. The information needed to create an account is just the basic identity information. There is 1 account per family. You use your email address, can be your username. You want to create a password for yourself. And there's also security questions that you will answer that are personalized to you, and only you would know. The second step in applying is the identity, the income, and the family members that you want to cover. The information that you're going to need is your Social Security number, your immigration status or family identification, which would be either green cards or naturalization information certificates or numbers. You need the income of the family. determines the tax credits. So that's what you're really applying for, is the tax credits or the cost sharing. As well as you're going to need your employer's information. You're going to need your employer's insurance coverage if it's available to you at your job, and it also has to be 9.5% of your overall salary if you're not going to take the coverage from your employer. And you should also use the available checklist that you can find at healthcare.gov or from one of our locations of what information you really need to bring before your application can be completed. So the next step is step 3. You want to pick a plan. What happens is after you complete your application, you will receive an eligibility letter. The eligibility letter is in the PDF form inside the marketplace. What comes on the eligibility letter is usually about 14 pages long. It will consider, you will have all the information there. It will tell you if you qualify for tax credits or cost sharing. It would also tell you if there's any information needed from the marketplace, when they need it, what type of information, where to mail it, or how to upload it. When you're picking a plan, you also want to consider your preferred doctors. You want to consider your drugs or prescription needs that you have. You want to be able to compare the plans and the level of plans that you need, or what levels of service or coverage that you need through different insurance carriers. You want to be able to compare the premiums, the deductibles, the benefits, the doctors, the covers, etc. So at healthcare.gov, you can also, there's an area there to compare plans. And so you can put the plans side by side and compare through your needs and see what's going to work for you, as well as you can go through and do the summary of benefits, which will be a detailed portion of showing you how, what the different benefits and deductibles that come with each plan. So the marketplace offers 4 different types of levels of plans. So they start off usually at the bronze level, which is only 60% coverage, and then you have the silver plans, which cover 70%. You have the gold plans that covers 80%, and the platinum plans that cover 90%. Usually the higher level plans have a higher premium per month. Also, your tax credits can be used towards any of the level of plans. The cost sharing is usually only towards the silver plans. So if you qualify for both subsidies, you can get the silver plan and use your tax credits with that, or you could just use your tax credits with all the plans. As well as for children under 30, or people under 30, I call them children, they can get the catastrophic plans. And those cover, I think there's 3 office visits that they can get per year, and will cover you in case something catastrophic happens.
Okay.
Step 4 is enroll and pay. So when you enroll into the plan, medical or medical and dental, you complete the enrollment steps. You await the confirmation from the marketplace, and you also contact your insurer to confirm the payment process, as well as make a payment per insurer requirements. So usually you cannot make a payment at the healthcare.gov website. I know it says make a payment, but you cannot make a payment at that point. But they do give you the phone number to contact your insurance company. So that's something, some people wait for the information to come to them. We prefer or tell people to call the 1-800 number that's listed there and ask them what their payment process is. Try to get your check in the mail as soon as possible. So that way your coverage can get started and you can confirm. So when you do call them, you need to have your application number as well. And then you call the 800 number to whatever insurance you chose and make sure you get that payment in and find out the correct place to send your payments.
Great. Thank you, April.
You're welcome.
So just so you know, all open enrollment starts on November 1st here in Virginia, and it ends on January 31st, 2016. So if you picked a plan between November 1st and December 15th, your insurance would start on January 1st. If you picked a plan after December 16th, your insurance would start February 1st. So it's a window of time that you need to get active fairly quickly. Now, if you want to actually make an appointment, there are a variety of ways to contact us. You can contact us at our phone number, 888-392-5132, or you can go to enrollvirginia.org and you can get information about us from there. Or you can go to getcoveredamerica.org/connector and make your own appointment there. And it's a fairly simple tool. When you go there, you'll see a screen like this. You can type in your zip code, and on your and that'll tell you what assisters are available. It'll be members like you met from the group, either April's group or Jackie's group or Rich's group or other groups that we have. And you can make an appointment and go visit them, and they'll help you through the process all for free.